Good morning. I welcome you warmly from Economic Forum in Karpacz. This is third day of this event, and our guest is Mr. Dimitri Gitas, Managing Director MSD Polska. Good
Good morning, how are you?
Quite well, as you see.
Good.
So we are meeting for the second time during the Economic Forum in Karpacz. Last year, MSD celebrated the 13th anniversary of its presence on the Polish market. And what progress has the company made in developing its operation in Poland over the past year?
Yeah, it's been a very productive year, I have to say. Shortly after we met last year, we joined the Warsaw Health Innovation Hub, which is one of the milestones, the big milestones in the last year, which is a platform where public and private can work together to identify innovative solutions to introduce to the healthcare system, and I think this is going to be an important platform for the future. Recently, a few months ago, we were designated a research and development center for the second time in a row, and so that just speaks to the level of investment that we make in research and development in Poland, and so we're very honored to have gotten that designation again. And I'd say that we've had a very strong focus on our people in the last year. And so,
Because of what?
just in general, we strive at MSD to be the best workplace in Poland. And so we recently opened our brand new office space in Warsaw, which is a very modern office space that has the highest level of technology and a great place for our employees to collaborate together and to bring the next set of innovations to Poland. And so we're really proud of our new office space. We also got a designation of Pracodawcy Zdrowia by the Ministry of Health. And then finally, we were also named once again a top employer in Poland. So a very productive year.
Very well. I must confess, yes, that's very productive and I suppose busy for your staff.
Absolutely.
And what contribution does your company make to development of the Polish economy and innovation, if I may ask?
Yeah, so Poland is a very important country for our company. And so we do a lot of research and development in Poland. And so we run around 120 clinical trials on an annual basis that allows us to partner with 400 institutions and provide treatments to 3,000 patients. And so on an annual basis, this amounts to around 160 million zloty on an annual basis. And so Poland is a very strategic country. When you look at the level of clinical research that happens here in Poland, we rank third in all of Europe for MSD and ninth worldwide. And so above and beyond the research and development that we conduct here, we also have a production site from our animal health business just outside of Rzesznia. So we do a lot of research, we do production, we cover human health, we cover animal health, and so it's a very important country for our company.
And also last year, in addition to the outgoing COVID-19 pandemic, brought another crisis related to the outbreak of war in Ukraine and the massive influx of refugees into Poland. How has MSD Polska responded to the new challenges to the healthcare system?
Yeah, the last 6-7 months have been quite challenging. Certainly, our hearts are out with the people from Ukraine who have suffered from the war. And it was important for us as a company to quickly adjust our priority, especially in the first few days since the invasion. Our top priority was the health and well-being and the safety of our people, both in the Ukraine, but also in Poland. And then also we had a priority of making sure that we can continue to bring supply in and medicines and vaccines for the people who benefit from them, both in Poland and in Ukraine. So continuity of care for our patients was of the utmost importance. As a global organization, however, we also assessed what can we do to support those most in need, both in the Ukraine but also in Poland as a result of the humanitarian crisis. As a global organization, we have contributed over $100 million in both product donations and also cash donations. As a local organization here in Poland, we work very closely with the Ministry of Health to understand what are their needs. We've donated vaccines in the areas that they saw of highest risk. And we also work closely with the NGOs so we can best support them in supporting those who need the support from the humanitarian crisis. And so it's been a challenging year. I feel like we've reacted quickly and responsibly, and certainly we need to have close contact with all our stakeholders here in the Ukraine, because the war is ongoing and the needs will evolve over time.
And after almost 2 years leading of one Poland's largest innovative pharmaceutical companies, how do you assess the stability of the Polish healthcare system and its resilience to the future health crisis? Because many people say about resilience that it's very important in nowadays times.
I think whenever you go through a crisis, and so we've gone through 2 of them in the last 3 years, it's always important to look back and assess how did we do and where can we be better. There have been reports that have come out recently to assess what has been the impact of the COVID pandemic, for example. We've seen over the last 2 years around 200,000 excess deaths in Poland. And when you convert that to per
100,000.
200,000 excess deaths. When you convert that to per 1 million population, it's among one of the highest in all of Europe. And what we've seen is countries such as Poland and other Central Eastern European countries, where historically the level of investment in healthcare was a little bit lower than, let's say, some of the other countries.
Western Europe, that's
Exactly,
obvious.
Western Europe. We didn't do as well in terms of managing the pandemic. So I think in terms of building resiliency for the future, I'd say the number one priority has to be more investment in healthcare. I'm encouraged. Recently, the Prime Minister announced that they're going to increase the investment in healthcare as a percent of GDP from 5.5% to 6.2% next year and 7% in 2024. I think this will be an important milestone to hit and to continue going forward, because some of the Western European countries invest around 10, 11, or 12% as a percent of GDP.
So our level is really low.
It's lower than some of the Western European countries for sure.
And what's your opinion about, because you mentioned about our neighbors, Central Eastern European countries. So I've heard about idea of coordination of healthcare systems in our area, I mean CE and Baltics.
Look, I think Poland has an opportunity to take a leadership position in the Central Eastern European region. The initiative of the Warsaw Health Innovation Hub is a perfect example. One of the other learnings from the COVID pandemic is the importance of partnership in bringing public and private companies together so we can identify areas of common interest and then implement in a more rapid and effective way to improve and strengthen the healthcare system and build more resiliency. This is an initiative that started here in Poland. It's gotten a lot of attention in other countries in the CE region, and certainly if we continue to evolve this initiative, Poland can take a leadership position.
And finally, I would like to ask about your opinion. What systematic solutions could meet the so far unmet health needs of patients in Poland? Because patients are most important. Finally, I suppose.
Yeah. So we talked about increased investment, and so the question is, where does this investment go? I think where we need to start is making sure that the patients in Poland have access to the most innovative medicines and vaccines. Broad and rapid access is really important. Typically in Poland, it's been measured that from approval from a European standpoint in terms of availability and reimbursement, it takes around 822 days. When you compare to a country like Austria, for example, it takes 315 days to get to patients. So that's less than half the time. So we need to be a little bit faster. And so broad access and rapid access to innovative therapies and medicines is really important. Then we need to look at the healthcare structure. There's a lot of room for improvement in terms of efficiency. And so we really need to leverage digital and digitize the healthcare system.
Digitalization is very, very important.
Absolutely, because this will allow broader access to the healthcare system. It'll allow more efficiency within the healthcare system. and consistency in the quality of the healthcare system, regardless of whether you're in a big city or a small city. Everyone should have the same level of access and same quality of care, and I think digital will allow us to get that.
But so really, we
please.
have made huge progress in digitalization of healthcare system.
Absolutely, and since COVID, I think we've been able to improve from that respect. I think there's a lot more room for improvement, so let's continue that momentum and get even stronger. And the other part is, let's develop data, make data available, and leverage the data so we can identify where are the inefficiencies. If you want to talk specifically about therapeutic areas, one area is in the area of cancer, for example. We need to do more to invest in prevention, vaccines that will allow us to prevent cancer. HPV, for example, Poland is one of the last countries to implement a national immunization program. HPV vaccines can prevent cervical-related HPV cancers, and so we need to have a program in there, get boys and girls vaccinated to prevent cancers for the future. And then maybe the last thing I'll just mention is in the area of lung cancer. Lung cancer is one of the highest causes of death in Poland. There are treatments that are effective, that are available to patients. However, the diagnostic to treatment process is very inefficient. And so only 50% of patients who are eligible to get treatment in Poland, and that's one of the lowest treatment rates in all of Poland. So we need to be more effective in diagnosing early, getting patients on treatment early, so the treatments can be most effective.
Okay, thank you very much for our conversation. Let me remind you that our guest was Dimitri Gitas, Managing Director MSD Polska. Thank you very much.
Thank you very much.